is Chad Ewald. I'm an EMT for Raystown Ambulance Service. I've been here for 5 years. I've been working in EMS for 25 years. We're here to show you a little bit about what we do on a daily basis and what my job entails. I will start by walking you through one of our ambulances here. This here is one of our newer ambulances. It is a 2019 Chevy. We're going to go over some of the equipment and show you guys some of the things that we do, some of the equipment that we use on a daily basis. I'll step inside and show you exactly what we do. Like I said, this is the inside of our units. We try to set up all of our units the same, to where all of our equipment is set in the same place. Okay. In these cupboards here, we have what we call bandaging material, which we cover. Which, if somebody has a bleed, somebody cuts herself, a broken arm, we can bandage that up and we can clean it until we can get to the hospital so they can get either stitches or getting it taken care of. This piece of equipment right here is considered our heart monitor. We put those on patients where we look to see if something's wrong with their heart, if they're having a heart attack, a stroke, or anything like that. We'll put that on there, and we can do actually a lot of different things with it. It's also considered an AED. This piece of equipment usually runs us right around $30,000. So all of our equipment is fairly expensive, so we try to take care of it as much as we can. Like I said, we can monitor your heart, we can monitor your blood pressure, and we can monitor your breathing with that as well. If you're having shortness of breath, we can tell how much oxygen your blood is carrying. I'm going to show you a little bit what our cardiac monitor does. This is the most used piece of equipment that we have in the ambulance. Like I said, it'll help us diagnose anybody that's having a heart attack, anybody that's having chest pain, shortness of breath. This will basically tell us what it is. Okay. We turn it on, and we actually we'll take these cables out, and we'll put these on 4 different places: right here, right here, right here, and right here on a patient. When that does that, it'll come up with what we call an EKG, which is a tracing of the heart. It'll come up here on this top line, okay? And we go to school to recognize what those mean, okay? Okay, as I stated, once we hook these cords up, it will show us a tracing like this. And like I said, we have to go to school to identify these. Now, I'm going to show you this. This was an actual patient I had. That if you look at these right here, this is considered what we call a normal heart rhythm. This lady actually had a heart attack, and as I was watching this patient, if you look closely, between right here, where I'm pointing my finger, this is the next one I have. This all happened within about 5 minutes. See how this here, right there, is starting to dip down. This lady actually had a heart attack right in front of us. Okay. As we go to the next one, we go a little bit further down and further down and further down. And also, if I refer back to this here, okay, these are basically the same thing as this, but it's an upside down picture of the heart, okay? And as we're looking at it from here, we keep looking at it down through each one in a different lead. This is starting to get wider and wider, okay? And as that gets wider, what's happening is your heart's starting to have problems working, okay? And this is going to real wide, okay? This actually, lady, right at the end, we went from a normal heart rhythm to where what looks like on a normal patient to something that looks like this right here, okay? And this is what you call a complete heart block, okay? And what happened here is her left coronary artery, which is the main artery that produces blood to the heart, was completely blocked. And when she had her heart attack, this is what happened, okay? And I'll put these real close together so you can see the difference between when she first started right here. This is a normal heart rate. This is her heart rate when we got her to the hospital, okay? You can notice the difference between this one and this one, this one and this one, which tells me, like with schooling, That turns around, and the lady had a heart attack, and her heart was not working at all, and she had a complete heart block until we got her to the hospital. This basically is our basic control panel here in a desk area that we work at. Controls all of our lights and that in our unit. Then if we turn right here, this is our box basically where we keep our medications and our drugs. Our IV supplies, if a patient needs an IV, we will get in there and use that. Down below there's our medications that we carry. They do have to be locked and secured. They are locked with 2 separate locks. That way, when we get into it, we have to have signatures saying that we were into it and we gave this person a certain med. We will walk around the ambulance. This compartment here has two separate backboards. What we do is if a patient has had a back injury or is in an auto accident, we will take them out, we will place them on this backboard, keep them secure, keep their spine in a straight line, and that way we will transport them to the hospital. These are what we call translucent, so they can be used if a patient goes to x-ray, they can just take them right straight on that. Then once the doctor sees those x-rays and those films, they will turn around and either take them off the backboard or they will stay on them until they can go to surgery. In this compartment here, we have what we call a stair chair. We use this to get people in and out of the houses. Basically, with anything with over like 2 or 3 steps, it's hard to get our litter in because our litter is very heavy. We will place this place the patient on this, and we will turn around and we can go up and down steps. It has tracks on it here we can pull out, and this is what rides on the steps, and we will go up and down. It makes it a lot easier to get a patient outside of the residence. These 2 things here are just basically extra oxygen bottles that we carry. We carry 1 big oxygen bottle inside the unit. These we can take out and we can take it to a residence. This compartment here is basically just our toolbox, an extra light. For if we were working on a scene at night, we need an extra flashlight. That's what's in here for us. And also a fire extinguisher. And as stated, this here is our bigger oxygen bottle, which stays in there, our green bottle. This here is what we call a reef stretcher. If we cannot get a stair chair or our litter up to a residence, or we're down, say, over an embankment or something, we will put the patient on this, and it has wooden slats in it, so it's very secure. We will secure them to that, and then we can carry them to our ambulance litter to where we can transport them to the hospital. This is basically a setup that we have. Most ambulances are set up the same. Our control panel is there in the center. And each of the ambulances are a little bit different, but most of them are set up basically the same way. That way we're familiar with every piece of equipment that we have. We don't have to really look for anything different. Okay. Next I will show you our litter. We do have a newer style litter and a stretcher, as some people call it. But this is a self-loading system. This system will hold up to a 700-pound person. Basically, we lift it like this. It'll start lifting like that, and we can pull it straight out. Okay? When it is in this position, it will literally hold up to a 700 to 800-pound person, and basically we can load or unload them with 1 finger. We have a set of buttons here. We push it, we let it down. Once it stops, we push it. Right. Then we can take the stretcher down to the patient's level. And once they get on it, we push a button and we pick them back up. It has really saved a lot from what we used to have. We used to have to turn around and pick the patient and the litter straight up and put them in the unit. But like I said, we just basically now we turn around and put these in here. Wait till they click. Like I said, another push of a button, and it will lift the patient and this litter up when we put it in. It has dramatically saved us as EMS workers, those that have started out on back injuries. It has cut down on back injuries probably by 60%.